Good afternoon, everyone, and thank you for joining us on our Healthcare Homes webinar, Guiding Principles and Innovative Ideas for Engaging Patients and Families. We're so glad you could join us today, so let's get started. Next slide, please. Before we begin, I'd like to read the Tribal State Relations Acknowledgement Statement. The Minnesota Department of Health recognizes and values and celebrates the vibrant and unique relationships between the 11 tribal nations in the state of Minnesota. MDH believes that the partnerships formed through a government-to-government relationship with the 11 tribal nations will effectively address health disparities and lead to better health outcomes for all of Minnesota. Next slide. Just a reminder that your microphones are muted upon entry, so please put any questions you may have into the chat queue. Next slide. We're going to go through one quick Healthcare Homes update. Just a quick reminder that accessing our free e-learning courses has undergone a bit of a change. To make the courses easier to find, we have placed a link to them on our Healthcare Homes Learning Collaborative e-learning webpage. Just click on the link for each course for a description of each course and a link to register for that specific course. Next slide. So what you've come to see is our webinar today, Guiding Principles and Innovative Ideas for Engaging Patients and Families. Before we get started, I'd like to introduce the presenters, Lisa Juliar, who is the Director of Patient and Family Engagement for the Minnesota Alliance for Patient Safety, otherwise known as MAPS, and Dr. Susan Pleasance, the Senior Vice President of Optimal Care for Health Fairview. Next slide. The learning objectives they are going to cover today are describe the importance of partnering with patients in the care and in the system, identify innovative strategies to engage patients beyond the Patient and Family Advisory Council, list 3 ways to co-design with patient and partners to improve care, and gain ideas from shared stories of success. And I will now gladly turn it over to Lisa.
I'm going to share my slides. I can get them started. Sorry about that. Okay, can you see the slides? Thank you so much for having me today. Just a little bit about myself. You'll notice that I don't have any credentials behind my name. I came to this work as a result of a medical error over 20 years ago. I was diagnosed with breast cancer. I had surgery. I refused radiation, and 6 weeks later, I found out that there had been a lab error, and I never really had cancer to begin with, but somebody else did. So I am very passionate about involving patients and families in the work, because when they are listened to and involved in the work, they're better about their healthcare. They become with your organization sometimes, and overall, it's a win-win. And just a little bit about MAPS, if you're not familiar with it. MAPS was established as a safety coalition in 2000 after a paper was written called To Err as Human that outlined how there were unsafe events happening in the hospital system. It was active as a coalition for 15 years. And then in 2015, we were established as its own 501c3. It was put together by the Minnesota Hospital Association, the Minnesota Medical Association, the Department of Health, Stratus Health, and Leading Age. And so we've expanded from being primarily hospital focused to really having the mission of safe care everywhere. And it's focused equally on patient safety and patient engagement. So why do you want to partner with patients and families? Really, the studies say that you have better outcomes all around when people are involved in their care and beyond. There are improvements in patient safety and quality. The scores for patient experience and satisfaction go up. And what has always surprised me is that the healthcare professionals express that they are happier and they stay around longer when patients are truly involved in the process. You get preferred processes, you understand more about what patients really want in their care, and it lowers healthcare costs. And really, at the end of the day, inclusion and transparency really create trust, and help people to seek care in better ways. So I'm a really big fan of storytelling and understanding how things work through other people's experiences. So I'd like to introduce Dr. Susan Pleasance today. She's going to share 3 examples of how Health Fairview included patients and families in their work. And then I will come back on and go through some logistics about what that can look like and how you might start that in your own facility. So I'm going to turn it over to Susan. Welcome, Susan.
Lisa, as Lisa said, Susan Pleasance. I'm a family medicine physician and the senior vice president for optimal care at Health Fairview, which means that I lead areas of our business operationally and strategically that help us drive to better outcomes at lower cost. So that includes our primary care areas, care management, senior services, and a number of other areas that need to come together to do that. And so we spend a lot of time thinking about how do we reach our communities, how do we reach our patients in ways that help them achieve those goals with us together. And so we spend a lot of time thinking about how we can engage patients in different ways. You can go to the next slide, Lisa. I'm going to talk about 3 specific examples. I would call these sort of progressive in complexity. And we do try to think when we're looking for feedback or when we've received feedback through our patient engagement surveys, we receive thousands and thousands of comments and we read them all. And that sometimes gives us some signals that there's something more we need to dig into with our patients. And so we use sort of what I would call different levels of engagement depending on how complex the kind of thing we're needing to solve is. So our most basic example would be we, for instance, noticed that we had patients who were using our online scheduling tools and we had options like, what are you coming in for? And one of them was a preventative care visit. And then others were office visits and chronic condition, things like that. And we were noticing a lot of people were selecting buttons we didn't expect. They were saying, I'm coming in for an office visit. And then they would type in the why they're coming in words, physical. And so we knew we had a problem. We knew that clearly the way we had phrased that or the way it was framed wasn't making sense to patients because the volume of people using different pathways was high. It's a pretty technical thing. There's lots of ways to do it. And so we started in this case engaging our patient and family advisory councils, which we do have a number of, particularly around registration and access and revenue cycle, like how to understand bills. We've already got an established group there. And so for the first bounce to get an idea of why we might be having that challenge, we brought this to that group, to a number of people in that group, asked for feedback, asked them to look at our new ideas. And then we actually did some what I call A/B testing, which is we said these 2 seem to make the most sense. And then we tried both in real life and we saw which worked better. And then we took that back to the patient family advisory committee. And now we have people selecting the buttons we expected at much higher rates than we did before through that cycle of feedback that we got through that patient and family advisory council. Sometimes the questions or challenges we're finding, they don't really work super great in a limited audience patient family advisory council, or it's very specific to something that they wouldn't have experienced. So we had another signal that we got both in patient feedback surveys, but also from patients on site, that we had a clinic that was co-located with a lot of other things. Some are businesses, some other healthcare groups. So one clinic inside a larger building of both Health Fairview and non-Health Fairview activities. And patients really had a hard time finding the clinic. And we had lots of signs all over the place. And so we really thought, I don't understand, how can people still not find it? And what patients were telling us is that it made them feel already on edge, more uncomfortable for their visit because they already felt like they'd made a mistake that day by being a couple minutes later than they had planned, even if they weren't late. And so we knew it was important to the patients that were giving us that feedback. So we actually asked some patients from another clinic, so they were established patients from a nearby clinic, to come and do what I would call like a walkabout, where we had them mock through an entire experience of scheduling a visit at that site, receiving the information on the phone that they would have received at the time of scheduling, the reminder messages. Then we had them drive up to the building and walk in and try to find the clinic. And we observed them, so we knew when they were coming, and we had people observing what they were doing. We tried to be subtle, but they're probably not that subtle. And we had watched where they stopped, where they looked. We had a number of people walk through this with us. And then we met with each of them after and interviewed them about what they noticed and what opportunities they saw. And because of that, we actually ended up having essentially greeters that we ultimately chose to be the solution because we already had lots of signage and it was just an overwhelming space. So we ended up shifting our front desk a little bit forward and meeting people right at the door and helping them more actively. And it has made a huge difference at that site. We no longer receive very much of that feedback. And then I'd say probably on the most complex end, there are some really challenging problems to solve. I don't know, problems is the right word, but opportunities facing healthcare that are much more complicated than being able to click the right button and find your way to the clinic. And those are things like how do we build trust with our communities? How do we engage with people in understanding healthcare differently? If we try to use the exact same methods that we've done forever, we see health equity gaps. And we're not going to close those by just doing more of the same things. And so we have a fairly robust community engagement program. We have cultural brokers, which are individuals who are part of specific clinics that are in communities that have often a number of different levels of unique needs, limited English proficiency, very deep community roots. And we actually send those people out to learn and listen in the community. And from those, we definitely saw a pattern across multiple languages that interacting with healthcare, you have limited English proficiency can be really daunting, and it can create low trust and people experience bias. And so we partnered with some of those cultural brokers, but also with our health equity teams and community advancement teams and local community members and leaders that we know and partners in the community to create sessions. We had 5 separate sessions, and we have more coming for getting feedback from people in the community. And this one we take a much more high investment approach. We go into the community. Every member of the team is formally trained in how to facilitate these conversations. Every member of the team that goes out is bilingual so that there's nobody that's part of that conversation that can't also speak the language of the community we're trying to reach. We bring their trusted community leaders to be part of the conversation, and we've pre-talked to them so they understand what things we're going to ask about and can help prepare people who are going to participate. We provide food and a stipend as well for people's time, because we find that sometimes with the volunteer committees, you get a specific audience of people who can participate, give their time to you for free, and we want to make sure we can get everybody's opinion. And so we've been facilitating these sessions over time to engage on various topics about what are trust breakers that happen in healthcare, how can various tools that we use across our care continuum better serve individuals who have limited English proficiency. And we've learned an incredible amount from that and have made huge strides. But of course, there's an infinite amount of gaps to close there, and we'll continue to do those and continue to engage with our communities and our patients in that way. So that's just a couple of examples among many of ways that we're trying to get feedback and use that information to help us deliver incredible care.
Thank you, Dr. Pleasance. I just can't even tell you how excited I was when I was connected with Dr. Pleasance, and she didn't know if she had any examples, but then it was 3 perfect examples that I was able to get her to share with you. I remember when we were talking and you said something about whenever you get to a problem and you're stuck on it, you've thought maybe we should ask the patients. And I just thought that was really impactful, because I think that's sometimes not something people think about, is to actually go into the patient community and ask them. So thank you so much for the work that you are doing and for sharing it with all of us. Let's see if I can go back to my slide. Okay, I just want to suggest as we keep going that patients and families can be considered experts. They may not be experts in the things that you all know, like scheduling or medical issues and things like that, but they are experts at how they like to get cared for, the medications that they take and how they affect them, what their living status is, and so on. They're also, I would call, innovators. I think often people think about things within their environment, but they have a limited scope because they're used to doing things a certain way. And when we bring patients and families into the room, they aren't used to those same things. And so they think differently. And I think that outside perspective allows us to have some innovation that we might not otherwise have without them in the room. They are advocates for their family members, for community members, and will help people when they need to get more information. They are ambassadors. I think what that's really important to know is that when you start working with patients and families, they really value that and they start sharing the good work that organizations are doing out into the community. They can connect you with other patient partners if you ask them, and sometimes they'll just offer them. They're typically very passionate about safety, even if they don't call it that. They want to make sure that the care that they're getting is the care that they need and that the care that they're comfortable with. And Dr. Pleasance talked about providing meals and some stipends, and that's always, I think, beneficial. But often patients and families will work for free for volunteering hours because they're just really passionate about being part of the solution and want to have a role in making a difference. I like to keep this simple. I think oftentimes when people are thinking about even starting a patient family advisory council or creating structures for this, it can get a little overwhelming to know how to start and how to maintain it. So I keep it to the 4 I's and try to make it a little simpler. And I think the first one is just really inviting them in. You typically won't have patients knocking at your door saying, hey, I'm really wanting to partner with you and work with you. But if you just put out the invitation, typically people will be responsive to that. Whatever you're working on, you want to include them throughout. And I would suggest from the very beginning, if you're doing a project, think about bringing a patient into the project right away and then find ways to keep them connected throughout. Even if it's a quick email, a call sometimes is really nice, but also just giving them opportunities to be part of meetings and know the schedule, things like that. You want to invest in their ideas. It doesn't have to be a big idea. It can be something small. I've often heard people say that they're afraid that patients and families will come in and have a request that they just can't meet. And that is going to happen. They will have lots of ideas and requests that they want. But I think our job is to listen to all of what they're saying and pick out even something that we don't think is significant, but they might think it is. And so one of the examples that I have is there was an emergency room that brought in some patients and they wanted to know how to change things. And there were 2 requests. One was to buy a big screen TV, and another was that the nurses' station was just a disaster. And they were concerned because they said, if you can't keep your space organized, what are you going to be like with my chart or my care? And so they didn't have the budget to buy a big screen TV, and then they shared that. But then right away, that director of nursing started a new organizational system for the front desk. And she put things in its place. She took pictures and then she sent them to the patients that had helped them think through that project. I think it took her maybe an hour or 2 to set something up at the desk and then share it out in a policy with her staff. And so it was something very small, but it made a big difference, not only because they changed it, but because they took that idea from the patient and ran with it. And then increasing their influence. So find ways to share out what you have taken from them and used. So you could do a highlight in your newsletter or on social media. You can send out a thank you that everybody can see. I think there's just a lot of ways that you can make them feel valued and then give them more opportunities to do more work with you. I think the other thing is to think about that is pretty simple is just to start asking more questions and finding more opportunities to ask those questions. So when they check into the clinic, when they get into the room, when they're leaving, when you're on the phone with them, and find a way that, like a funnel of information that you can share that with your teams. Some of the questions that you could consider asking are, what's working well? What do you like about your care when you're here? What's not working? What keeps you coming to the clinic? And maybe even getting more specific about that as you get the answers. You can ask them what they're worried about, either before, during, or after an appointment. And then just simply, what ideas do you have that would make your healthcare experience better? And even, it doesn't even have to be about healthcare, but anything that you're doing with them, what do they see could be different? It can be a little frightening, I think, at the beginning because people think they have to act on it. But I think that so often patients and families feel really engaged just by being heard and having those questions asked of them. So I think these will be very familiar to all of you. These are really the ways that you engage patients and families as you're providing direct care. Shared decision making by just giving them options and opportunities to decide how to get their care or what medication they're going to use, when they're going to come back, under what circumstances, and having those discussions versus just telling them what they need to do. And along with that goes the education. You have to give them the education before they can do some decision making that is relevant to them. The process of teach back as they're leaving, and then self-management strategies and some way to keep their medication list so that they have ownership of that and aren't relying on maybe your system to give that to them. But my favorite part is how to engage them beyond the exam room. And there's really a lot of ways. I think over the last 15 years, which is that's about the time I've been working in this, there's been a lot of focus on patient and family advisory committees and having a separate committee to help your organization with their decisions. And I still think that's a really great model, but it is hard to maintain because it's a whole separate thing that you're trying to do. It's hard to recruit sometimes for a larger group, and then to figure out how to embed that with the other work that you're doing. So I often think that it's evolving to think about having patients and families as part of teams. So perhaps you invite two partners to serve on your quality improvement team. I worked with a clinic who had a certain project they were working on about how to room their patients. And right from the beginning, they had two patient partners at every meeting. And not only did they talk about what the process should look like, but they involved them in how to implement it. And then when they rolled out the new policies and the new procedures, they involved the patient partners in celebrating that and getting it out to the staff and knowing what the next steps were. You certainly can use surveys. I think you can certainly do everybody in the clinic, or you could create a base of patient partners that are willing to participate in surveys that are specific to a project or to a topic that you're really interested in learning more about from your patient community. Any kind of project or work groups. And then creating educational material. This is a big one that I recommend. You don't just create the educational material and then share it and ask them, is it good? And do you understand it? And how will you use it? But ideally, when you have an idea that you're going to create an educational material for that you start with having patients in the room and talking about what it is that what the topic is, and ask them what's important to them. How would you like it expressed to you, and what would make the most sense? And they're really good about sharing how that looks and what they want to be part of. It is also good if you already have established materials to ask them after it's done. I just think it's a better practice to get them started from the beginning. So just some best practices that I have found over the years is that obviously you want to involve them beyond the point of care, beyond just what is happening with them in their appointment and things like that. You also want to consider having more than one patient when you're doing anything. It's always better to have two, because then they're more comfortable. They feel like they have a colleague and someone that they can relate to. They don't feel so outnumbered. But also, just when you have meetings and one can't show up or has a conflict, that the other person can be there if the other one's gone. So I think that's a really great way to set it up. You want to strive for diversity. You want to see who represents your community. But I will tell you, this is a really hard thing to do, partly because it's the older people that have the time to put into it. A lot of people work during the day or they have kids, so that can be hard. But I think by diversifying kind of the way that you interact with people, you can get more people involved in different ways. For example, with the survey, or perhaps you once a year do a Saturday morning event where you can invite different people. I have talked to many people like Dr. Pleasance, who they go out into the community. And I think that's a great way to find the different people that you're looking for. And sometimes if you go out into the community, they're more apt to trust you and want to come in later on for a project or something else that you're working on. I am a big fan of the stories, and I think that's one thing you can ask questions about is, what was your experience like, and would you be willing to share it? I highly recommend sharing stories that maybe aren't so good and finding a way for a solution for them, and then giving them opportunities to share the story that maybe wasn't so good and how you work together to come up with a solution. That's how you get your best advocates for your organization, is when they have something wrong and they feel heard and they're allowed to be part of that solution. And then when you bring patients and families into the work that you do, to the meetings that you're having, you don't need to be non-medical. You don't have to worry about talking without the medical jargon. However, you might want to just be aware of it and point out that if there is anything that they're not understanding, that they can stop and ask a question. Acronyms are a little hard, so that's one area I do recommend trying to stay away from. But I would say all of the patient partners that I've worked with really do understand most things that are being said within these meetings, and they pick up by just being there and listening and learning more. So recruiting patient partners, I think that's a little scary for people. You really want to be open and creative about who to invite, and being able to approach a broad range of people with opportunities for a broad range of opportunities, I think is part of the key. Always provide some sort of training, giving them the expectation for how they're going to be involved and maybe what they need to do. For example, I talk a lot about, you're not here to really share specific examples necessarily, but more of a broad view of how what you've experienced could impact others and how that could be made better. I also try to suggest that you partner a patient with maybe a staff at the beginning, just as a 1 or 2 time check-in to say, hey, if you have any questions, you're uncomfortable, you need any more information, this is who you can contact. And then provide training along the way. If you're working on a specific project or it needs a little bit more information for them to be able to do the work, provide that for them. You can seek recommendations from staff, from the people at the front desk, from doctors to people who room them, the medical assistants. I think it's a really great way because they spend a little bit more time talking to them than maybe the people that are going to facilitate some of this work. Always use a variety of tools for invitation. Obviously, you could even use, I think, the portal to invite people or your email list. But I think there's value sometimes in picking up the phone and reaching out to people when you're looking for help. You could use social media. You can use word of mouth. Sometimes it's great to just invite one of your neighbors and see how that goes. And then partner with organizations from the community. You can find organizations that are related to the elderly or to the disability community or cultural organizations. Oftentimes, those organizations have access to a broad range of people, and they can start sharing the information first on your behalf, and then partnering to connect people through you. And then retaining those patient partners, really keeping in contact with them, touching base to see how they're feeling and what they might be struggling with, if they need anything from you. And a way to share gratitude is really helpful. It does not have to be money. Food works well oftentimes, and a quick note to them is great, but also just a thank you. And we really appreciate you being part of this work. Goes a long way. And I think sometimes I have had experience where people will drop off or stop coming because they didn't find it meaningful. There wasn't enough opportunity for them to actually dig in and do something. So they don't want to just be part of sitting there listening to information. They really need something to respond to or write or be a part of. And that can be tricky. It can be tricky to find those roles. But once you figure out ways to do that, it's just so amazing to see how they jump in and the amount of time that people are willing to give once they get connected to an organization that's willing to partner with them. And then maybe schedule consistent check-ins, whether it's monthly or quarterly, just to say, hey, we really are glad you're with us. Just let us know if we can do anything for you. Can really help them to stay engaged in it. Otherwise, if they don't hear from you for a year, they just forget about it and don't really come back and ask for more work or more ways to partner with you. Dr. Pleasance actually commented on walkabouts. They're a great way to start engaging patients and families. And there's a lot of ways to do that. She explained one. It's really just starts with inviting maybe a small group, 3 to 6 patients or family members, community members, and include them in an overview of the project. Tell them why you're doing what you're doing, what you need help with, and what their role will be. And then also tell them what the next steps will be. Like, how will you get them the information like that you gathered from all them, and then how you will use that. I was talking earlier about an emergency room with the front desk and the TV. That was through a walkabout where they knew they were getting a lot of bad scores on their surveys about their emergency room in particular. And so They invited, I believe there was 7 patients that came, and they gave them a clipboard, and they had them just really sit in the emergency room, walk around the emergency room, not just the waiting room, but they were roomed, and they went through the whole process of being an emergency room patient. And they gave them a clipboard, and they also let them use their phone to just record pictures or recordings of different things. And it was interesting because they all did it separately, but unanimously, the 2 things that I shared about the big screen TV, that there wasn't one. There was no TV in the emergency room, and it was a small rural town. And they said, we will not bring our young children here if you don't have a TV, because they scream and they're bored and it doesn't work. And so we don't want to do that. And then the other part was the front desk. What was interesting is that the conversation around the big screen TV took a little while, and they understood that there was no budget for the hospital at the time to buy a large screen TV. But what happened after that was that those 7 patients got together and rallied their community and did a fundraiser and purchased that large screen TV. And so it was a win-win for everyone. They didn't have to really do anything to get that large screen TV, except they had invited those patients to be part of a solution to a problem. I'm guessing, I never checked back in, but I'm guessing that those scores on their survey did indeed go up, because they did do quite a few things on their own to change based on what the patient partners had given recommendations for. They did have a formal meeting to discuss what the patients had recommended. And then they went back, they did some of the work, and they brought them back for a lunch to thank them and tell them what changes that had been made. And that was really impactful for them too. So you can debrief and immediately after something like that, but sometimes it is good to follow up and go back and discuss it and share what your next steps were. A really great way to start, I think sometimes a great first step, is just to start inviting patients, residents, or families to share a story. It can be a great story. It can be a difficult story. It can be a story of how they used your clinic to get better, things like that. But I want to encourage you to think outside of the box on where and how to use those stories. And when I talk about using a story, I am not talking about a nurse telling a story about a patient and what happened. I'm saying invite that actual patient in to really share what they're thinking and feeling. It is a good idea to have somebody that can talk through that story with them and give them a little bit of coaching about what to say or not to say, not to change their story, but to fit the audience for what the story will be given to. You can use them in team meetings before work sessions. So, for example, I recently did a project on giving test results to patients after they leave the clinic, and what happens when when there isn't follow through, when maybe they don't receive the test results. And before we started that project, we had invited a patient who we knew had a mom that was sick and had some chest x-rays done. And they never received they received the first results, but there was a second look at the x-rays that never got expressed to the family, never communicated. And the mom got fairly ill, and the family was really disappointed later to find out that communication had been missed and that there was something more wrong with the mom's lungs, but they had never been told. And so it was a great way to really kick that project off, to talk about, share what that was like for that family and how that impacted how they felt about the organization and what they did with their care afterwards. But on the flip side, for that patient who was telling the story, she felt a lot more ease with the organization that maybe she was a little frustrated with, because they listened to her, they gave her a platform to share that story, and then they involved her in that work group afterwards for the solution on how people want to be communicated with and how to make sure that communication is pushed out. So there's many ways to use those stories. If you have retreats that you do as an organization once a year, that's a great place to invite a patient. If you are celebrating something, of course, that's a great way to start a celebration, is by sharing a story. And beyond that, I would even say sharing your staff stories is also very powerful. And even sharing a staff and patient story together, where they both share about something that happened within their care that either went well or didn't, and how you might use that in the future. Oftentimes, when people are thinking about inviting patients and families to be involved in this work and to get started, it can be really overwhelming. A lot of questions that people have is around the policies and procedures and the HIPAA, and how are we going to maintain it? Who's going to manage this system? And I think those are all great things that you have to consider. And there's a lot of resources out there. Involving patients and families at these levels is not new. It's been around, and people have been encouraging it for as long as I've been working in it, which is 15 years. But I think that it can get overwhelming when you start there. And I suggest really starting with something simple and just fun. Just have some fun with it and be excited about connecting with patients and families in a different way that can get you partnering in the work that you're doing. And so just really determine a way to gather some feedback and give them a warm welcome, and encourage them when they come to any event to just be honest that no idea is off the table. Some of the things that I have seen that have been really helpful or effective is like sharing root beer floats when patients come into the clinic already, and having a flyer that says join us, whether it's just giving information on what you're going to be setting up, or perhaps you have something where you're going to gather information from them. So you can have an event where they come for an hour and you have a question that you want them to answer. I've seen people do an afternoon tea, just a meet and greet. Who are their people in our community, in our clinic, and getting to know them in a different way than providing care for them, but actually just saying, we need each other. We want to get your perspective, and we want to invite you in just to get to know you and see how that might work. You can give them information about the kinds of work that you're looking for them to help with. You can do surveys on how they might want to be involved. Is it a patient and family advisory council, or the surveys and what those surveys might look like, how often you would want people to be involved, and what their commitment is. But really just finding ways to have fun with it, and maybe planning things that are during different times of the day and of the week. If there's a possibility of having an evening event once a year, or a Saturday morning event once a year, where you just say, hey, come and meet us. We want to thank you for using our clinic, and we're looking for people to work with us, to partner with us. And that doesn't have to go out to the whole community. You could share it with a small group. You could invite 10 people that you are really thinking might be passionate about that. When I think about who to invite, sometimes if you have people that are calling in with a grievance or that have had a bad experience, it's a great place to start. to say, hey, this didn't go very well, or you're not very happy, but we really want to know more about that. And giving them a space to share what they're thinking and help them to be able to be part of the solution in what they're upset about or what has been bothering them. And oftentimes, just having that listening ear will change their mind and they won't have any grievances, or it's a great way to fix it. I hear from patient partners all the time about when they share a grievance or they're upset about something, that they don't get an authentic answer to what they're upset about, or they feel brushed aside. But every single time that I've talked to a patient partner or patient who's put in a grievance, if they've been given the opportunity to say, we hear you and we want to know more from you, they just feel a lot more trust and compassion and understanding. And so often when you are engaging patients and families and you're bringing them into the work that you're doing, the benefit is that they start to learn what you are dealing with or what things you have as barriers that maybe get in the way of providing what they want. So one example is just regulations from CMS or the Department of Health. As an example, if there's a regulation that you're trying to accomplish, I'm going to make it up, but washing your hands, which everybody knows is good and you have to do it, but it's in the way maybe of introducing yourself right away. It's just helpful for patients and families to start to understand what you're all dealing with and why things are set up the way they are, because often they don't understand. It's foreign to them. It's not what they're used to. I know for me, that was really a big impact for me, is that I had no idea about all of the regulations and rules that needed to be followed in healthcare. So even as simple as like hanging a sign up, and how many things need to be considered when you're going to hang up a sign to share information with people. So I think that's a really cool way or it's a great result of having people come in and start working side by side with you on something. Just start small and have fun and see where it goes. When I started this work, I had heard this great quote from Atul Gawande that said, outsiders tend to be the first to recognize the inadequacies of our social institutions, but precisely because they are outsiders, they are usually in a poor position to fix them. And so I would just encourage you to invite them in. The people that are outside of your work, get them in there and ask their perspective. I had something recently that happened where there was many people, many authors who were writing a paper, and I was in charge of facilitating it and getting it to the publisher. And so I looked at it probably, I don't know, 30 times. I had other people look at it. We dotted all our I's, crossed all our T's, checked everybody's information over and over again, sent it in. And then when it became published, right away I got a phone call that there had been a mistake in somebody's credentials. And it just illustrated to me the way that this work happens is you are so focused on your work every day. I was so focused on that paper. All the people that were part of the paper reviewed it over and over again, looking to see if there was anything that needed to be edited or changed, or making sure that everything was just right. And we all missed it. And as soon as it went out into the world, it was out there. But I think so often in healthcare too, we are all in the room knowing how these policies and procedures work, and we get so focused on how it's done, we might not be able to see how else it could be done. And that's the power of engaging with patients and families in the work that you do. I'm going to stop there. I would love to answer any questions, or if I can, if you have any. I'll stop sharing my screen.
Wonderful. Just a reminder, if you have any questions, please put them in the chat. That would be great. And while you're typing those into the chat, just a reminder to everybody, there is the webinar evaluation that's been placed in the chat as well. We also have an option now for a QR code. So you can also scan the QR code with your phone and complete the survey form. Oh, we'll just wait a minute because I know it takes a second to type.
If you don't have questions, I'd also be interested to know if you have any successes or wins that you want to share, or something that has gone, that you've tried, that maybe worked or maybe it didn't.
Absolutely. We love learning from each other in this business, that's for sure. And if you have any questions after the webinar, please don't hesitate to email our website, or our email address, excuse me, below, health.healthcarehomes@state.mn.us. We're happy to pass them on to Dr. Pleasance or Lisa. Seeing no questions so far, Lisa, thank you so much for presenting today and creating a great ideas and brainstorming of ways to really engage our patients, and that aren't expensive, they're not complicated, and they make a big impact. And so I really appreciate that. And thank you to everyone for joining us today on this Healthcare Homes webinar. Again, the survey is in the chat or on the QR code on your screen. And a big shout out to Sadie Anderson, who runs everything in our background and makes our webinars run. Obviously, we really couldn't do it without her. You will receive an email soon with the slides and resources, along with a link to the survey. If you have any questions, again, please don't hesitate to contact us on the email address below. And thank you for joining us this afternoon, and have a great rest of your day.
Thank you.